Good evening, welcome to the Pearl Report. I'm Diana Lin. Many children who've succumbed to diseases have to spend their precious childhood in a hospital, a place dreaded by many people, even adults. Producer Yvonne Lou met some professionals drilled to plague with sick children to make their treatment more bearable, amid calls to train more of these hospital play specialists, also known as child life specialists.
"11-year-old Oscar Chan is still under the effect of sedation. Oscar just emerged from a bone marrow aspiration to check for malignant blood cells. He had a bone marrow transplant this April to treat his leukemia, diagnosed last summer after being feverish for 3 weeks.
That bone marrow needle is really thick. Each time he's injected anesthetics and sedatives, and I tell him, you won't feel a thing once you're asleep. Fortunately, there's a play specialist to play and talk with him to divert his attention a bit.
May Lam is a hospital play specialist with the Hong Kong Children's Cancer Foundation, an NGO providing the service for over 2 decades. Before a bone marrow aspiration, May prepares Oscar through a set of games, known as medical play. Next, they simulate the extraction of bone marrow samples. Administered through a tube inserted into Oscar's chest. The tube has to be cleaned at Queen Mary Hospital twice a week.
Of course, I was frightened, so I cried hysterically.
The hospital is always full of fear. So if we could prepare the child for medical procedures, help the children to understand more about the disease, probably we could make the patient journey a little bit more pleasant.
She told me if the wound's not cleaned well, bacteria would be trapped inside and the tube would have to be replaced.
Now for the real thing.
Sometimes parents can't go into certain areas. Only hospital play specialists can accompany him. At least he has someone he knows to be with him.
May built a rapport with Oscar during the 50 days he was confined to the bone marrow transplant room.
She can help him unleash any unhappiness through play and talk. It may relieve his pain, too. She's seen many different sick children. She knows what discomfort certain medications can cause and talk with him accordingly.
We need to learn medical terms and different protocols for diseases.
The chemotherapy before inflamed my appendix, so I kept having rather serious stomachache. I was quite worried about that. I felt really uncomfortable.
Perusing reference books, May found a method called guided imagery, in which she verbally guides Oscar to exercise his creativity and imagination.
It brings him to a very peaceful place, and he can draw a picture of it. Whenever Oscar feels really bad, he can look at or recall that drawing, and he feels better. Our training involves psychology basics, so we have an idea how well kids his age understand abstract thinking. He can grasp and accept rather difficult terms. He tries to use his imagination to help himself.
Later, I tried to relax when my stomach ached to divert myself from the pain. A few days later, my tummy no longer hurt that bad. She helped me a lot without her telling me what the tube is for and what bone marrow transplant is. I'd be really worried.
I admire Oscar. I'm proud of him because I can see he's made big progress. Initially, he suffered a lot. He was nervous. Now he's used to everything. Bravo!
He only screams when he is in great pain. He's matured a lot. He even tells me, "Don't worry, I'll recover." Turns out he's a lot stronger than I'd imagined.
May used to be a social worker and has been a hospital play specialist for 3 years now.
The title Hospital Play Specialist fascinated me, so I applied. Because play is kids' first language, so most of them really welcome the idea.
Currently, only 19 hospital play or child life specialists are offering services in 9 public hospitals. Last January, Lao Yi Kwan, now aged 5.5, was diagnosed with cochlear and skull infection. 1 month after surgery to remove pus, blockage of cerebral blood vessels was detected. She was put on blood thinner. She has to have MRIs to see when she can be weaned off the drug. First, an intravenous cap is inserted into her hand, so contrast medium can be injected later.
Okay.
Phoebe Ko is a hospital play specialist.
We will teach how a father can hold her girl so the girl can feel comfortable, and then she won't move too vigorous, and then the doctors can do the IV cap.
Family-centered care is the most effective way of giving medical health care.
And that is our role, to facilitate parents really do their role to support their kids, and it is unique.
She knows what she can do to help me. She can keep her hands still. She can be very cooperative.
Why don't the doctors or the nurses do the hospital play? It's a role conflict. This moment you play with a child, okay? The next moment you put in a needle. the children will not believe in you.
Hospital play specialists help us a lot. When calming the kids down, they have many tactics to divert their attention, so the procedures can go smoother.
This is the first time Yi-Kwon undergoes an MRI scan without sedation.
MRI is a very scary experience. If we can use the hospital play to prepare the children, prepare the parents, studies have shown that the children with hospital play actually could use less sedation. A lot of procedures inside the hospital require cooperation, not sedation.
小朋友要照磁力共振，咁佢要點樣啊？我哋都有一件嘅。
We have a model which can really let Yi-Kwon try pushing the kid in.
試下推個小朋友入去啊。
Computer software is also used.
我哋同個腦袋影相嘅，係咪？你自己撳啊。咁我哋一定係啦，好似小朋友咁樣啦，會瞓低啦，跟住就會將床會升高啦，記唔記得？係啊，好似上太空咁樣，我哋唔痛噶嘛。其實佢中間咧，佢可以擘大眼。總之只要你個頭唔好喐就得㗎啦。咁你耶邊度？去啦！你一陣間瞓覺，你咪冇咁揞住咯。
If she starts getting scared or can't hold it, you can see her wriggling her fingers and toes. Then we might immediately speak to her through the microphone or notify our colleagues. She's done her best. It was really hard to pull through.
Phoebe has been a hospital play specialist for 2 years now.
It's most satisfying to see the children accomplishing the necessary checkups. This gives the children a sense of achievement and builds their self-confidence.
There's no official system for hospital play services in the city. The NGOs providing the service follow American and British standards.
We required a degree in some human services, and then we will go through around 480 hours of clinical training in under supervision of a qualified child life.
2 years ago, some doctors proposed having play specialists in all hospitals under the hospital authority.
Play therapy is an important component in the treatment for children, especially for those with severe diseases. In the Hong Kong Children's Hospital, we should also set up a similar kind of play therapy. But at the moment, it's still under planning process. What is the best model?
In the United States, the United Kingdom, Australia, New Zealand, hospital play is considered a benchmark of quality service. In Hong Kong, we have to start training hospital play specialists.
Especially for the Children's Hospital due to open in 2018.
Children with severe illnesses would be hospitalized there, and they require a lot of treatment, and the last thing we want is a lot of children crying inside the hospital.
When we come back, how he's recovering from a rare condition thanks to multidisciplinary care.
It was more of a community more than anything else.
And a godsend for local children in dire need of centralized and advanced medical care. Stay with us.